Welcome to Raaonline. I'm Dr. Thomas Alexander, consultant cardiologist at the Kovai Medical Center and Hospital, Coimbatore, and director of STEMI India. What we'll do over the next 10 minutes is to look at what a 12-lead ECG does and look at some of the important aspects about reading an ECG. Now, ECG is critical to managing coronary artery disease, and therefore I think it's important to know how it's done and what to look for when you do an ECG. Now, the process of recording the electrical activity of the heart using electrodes placed on the patient's body is an electrocardiogram. Some places you will see it reported as ECG, others as EKG. They both mean the same. And it's the most commonly used tool to diagnose dysarrhythmias, conduction abnormalities, enlargement of heart chambers, myocardial ischemia or infarction, electrolyte abnormalities, or the effects or ill effects of some of the medications. Now, I think it's important for us to know a little bit about the conduction system. Now, electrical cells are arranged in a systematic pathway, and their primary pacemaker is the SA node, which is located on the upper part of the right atrium. Now, the SA node has an intrinsic rate of 60 to 100 per minute, but there are secondary pacemakers. So if the primary pacemaker fails, the secondary pacemakers take over, provided they are also not diseased. So if it is a junctional pacing that happens, it occurs at a rate of 40 to 60. But if the site of pacing is the ventricle, it's usually 20 to 40 per minute. Now, electrical cells are part of the conduction system, and the rate of conduction also differs. And this is important in the scheme of things so that the heart contracts sequentially and is able to eject blood. So the atrial and ventricular muscle conducts at 0.5 meters per second. AV node is the slowest. It conducts only at 0.05 meters per second, and there is a reason for it. The bundle of His and the bundle branches conduct at 2 meters per second, but the Purkinje fibers, they are the fastest, and they conduct at 4 meters per second, and this is important for us to understand. So depolarization starts in the pacemaker cells, and in normal circumstances, it's the SA node. It passes through the atrium. There might be a specialized tissue which conducts to the AV node. At the AV node, the conduction is slowed down. We saw that the rate of conduction is much slower, 0.04 meters per second. And then to the bundle of His, to the right and left bundles, to the Purkinje fibers, and then to the left and right ventricles so that contraction occurs. Now,